Hello, my name is Megan Wysong. I use she, her, aya pronouns, and I am a program analyst at Paid Leave Oregon. Thank you for watching this video about Paid Leave Oregon, an exciting program that provides protected paid leave to Oregon families when they need it most. This presentation is specifically designed for you, medical providers, and focuses on important information you need to know when you're filling out medical verification forms. We have a separate presentation to help your clinic navigators understand paid leave and support them in helping patients navigate the application process. Today, I'd like to give you a brief overview of Paid Leave Oregon with a focus on the important role healthcare providers play in their patients' claims. To support providers, we offer resources on our website at paidleave.oregon.gov. Under the Provider tab, you'll learn more about your role and how to help your patients. We include the forms you'll see, fact sheets, and key information. Your role in the paid leave application process is incredibly important. As a provider, you play a key part in helping people get the benefits they need during a critical time in their lives. Specifically, your role is to verify that your patient has a serious health condition and needs to take leave from work. You do this by completing the verification form they give you. When a patient gives you this form, we ask that you complete it and return it to them as quickly as possible. Your timely response makes a difference in their ability to receive support when they need it most. Other forms you may see from patients include our verification of birth, safe leave verification, and claimant designated representative forms. Next, let's dive into the program and how it works. Paid leave is a state program that gives eligible employees up to 12 weeks of paid time off for when many of life's most important moments impact their families, health, and safety. Someone can take paid leave for family, medical, or safe leave. Family leave is for caring for a family member with a serious health condition, caring for and bonding with a child in the first year after birth or placement through adoption or foster care, completing necessary activities before adopting a child or having a foster care child join their home. Medical leave is for caring for themselves during a serious health condition, and safe leave is for caring for themselves, their minor child, or adult dependent if they are survivors of sexual assault, domestic violence, harassment, bias crimes, or stalking. Someone can receive 2 additional weeks for limitations related to pregnancy for a total of 14 weeks in a benefit year. Pregnancy limitations are broad and allowed for anyone who is pregnant. Individuals can take this extra 2 weeks before or after giving birth. There are two options for a leave schedule: consecutive leave or intermittent leave. Consecutive leave means they don't work while they are on leave. Intermittent leave means they may work some days while they are on leave. The claimant must fill out a separate application for each qualifying event. This means you will need to fill out a separate verification of serious health condition form for each event. Patients with a chronic condition must file a new application at the beginning of each new benefit year, which means they'll need a new verification form from you. This slide describes a serious health condition for paid leave purposes. A full definition of a serious health condition can be found in our administrative rules or on page 3 of the verification of serious health condition form. The main point here is the serious health condition can be a physical or mental condition and requires multiple treatments or visits. It will take time for the patient to recover. Involves a period of incapacity means the patient can't perform at least one essential job function, attend school, or perform regular daily activities for more than 3 consecutive days. Remember, a serious health condition is what you are certifying when you sign the form. It is important to remember that when you sign the certification form, you're confirming that the condition meets the definition of a serious health condition. To be eligible for leave, a claimant must have a qualifying event that we can verify. They must also need to take leave from work due to their or their family member's serious health condition. Claimants must provide documentation to paid leave when they send their application for benefits. As a provider, your role is really important as you are the one certifying that they or their family member has a serious health condition. You might receive a request from a patient or their family member to complete a form or provide documentation to verify their need for leave. We recommend using the paid leave forms when possible, as it's more likely that we'll get all the information we need to verify their serious health condition. Some examples of qualifying events are disability due to miscarriage or stillbirth. This includes both physical and mental impacts related to the loss of a pregnancy. Caring for and bonding with a child in the first year after birth or after they're placed in a home through adoption or foster care. Caring for themselves or a family member with a serious health condition. Limitations related to pregnancy, childbirth, or related medical condition, including but not limited to lactation. Caring for yourself, your minor child, or adult dependent who is a survivor of sexual assault, domestic violence, stalking, bias crimes, or harassment. Some examples of non-qualifying events are non-serious illness, bereavement, and military leave. It all depends on the facts and circumstances of each case if something is serious or not. This is the first page of the verification of serious health condition form. The form instructions include both the definition of a serious health condition, as we've discussed, and the definition of a healthcare provider, which we'll review next. This slide lists examples of which medical office staff can sign the verification of serious medical condition form. You can also find a list of the healthcare providers on the verification of serious health condition form and defined in our administrative rule. Healthcare providers can be in Oregon, another state, or another country. However, they must be licensed or certified to practice in accordance with the laws of the state or country in which they practice. Besides being on the list, the healthcare provider must be primarily responsible for providing healthcare to the claimant or family member. Chiropractic physicians are only allowed to sign the form if they provide treatment consisting of manual manipulation of the spine to correct an issue that was seen by X-ray. Here are some examples of office staff who can't sign the form. Certified medical assistants, CMA, certified nursing assistants, CNA, certified patient care assistants or technicians, chiropractic assistants and caregivers, counselors, licensed or not, licensed marriage and family therapists, and certified alcohol and drug counselors, CADC 1, 2, 3. None of these people can verify serious health conditions for Paid Leave Oregon. Here is the information you need to include either on our form or your document. A short description of the serious health condition, including symptoms or required treatment plan, the start and end date of the serious health condition or when it created the need for leave, an explanation that the condition is chronic or permanent. For intermittent leave, the number of days per week that the patient may miss work. Your first and last name, type of medical practice or specialty, business name, address, and phone number. Your handwritten or electronic signature, no stamps, and the date you signed the document. The document must be dated within 60 days of the employee's first day of leave. If claimants use other forms for verification, those must include this same information. To help avoid delays in processing your patient's claims, we have identified some items you will want to make sure you complete when filling out the verification of serious health condition form. Make sure you fill out all sections for the healthcare provider. On this form, that is pages 4 through 6. Incomplete or illegible responses may cause delays. Check the provider certification box. If you don't check the certification box above the signature line, we can't accept the form. Don't make any corrections or alterations to the form, including using whiteout. Include diagnoses or enough information for us to verify the serious health condition. This could include symptoms, a treatment plan, or a description of how the condition keeps the patient from working. When you provide relevant medical facts on page 4, do not use language like unknown, indeterminate, or TBD, as we can't accept those. Please be as detailed as possible and include a diagnosis or a description of the symptoms and required treatment of the serious health condition. If a patient is terminal, please check the box for danger of death or terminal prognosis. Only select the box None of the above in section C, page 5, if your patient doesn't have a serious health condition according to the definition. If your patient has a chronic condition without an end date, please provide an estimated date for the end of the current episode of incapacity. When estimating an end date, please consider the length of time your patient or their caregiver will be either out of work or working intermittently. If your patient has a condition or treatment that impacts them intermittently, you should provide the most days you would expect them or their caregiver to miss work each week. Choose a number of days between 1 and 7. Paid leave cannot set leave at a monthly frequency like OFLA or FEMLA. If you don't list an estimate of the number of days each week and for how long your patient will miss work, they will have to get new documentation. If a claimant can't apply for benefits or choose a representative because they are incapacitated, a family member can request benefits for them. You, as their healthcare provider, must first confirm the patient's serious health condition and incapacitation by completing and signing Part E on this form. Incapacitated means a condition where a person's ability to receive and evaluate information effectively or to communicate decisions is reduced so that the person can't meet the essential requirements for their own physical health or safety. In summary, we discussed your role as a provider. We talked about the provider page on our website, including fact sheets with valuable information about how medical providers can support their patients through this process. We talked about the 3 types of paid leave: family, medical, and safe leave. We talked about how claimants can take leave, what is a serious health condition, and gave examples of qualifying life events. We went over the serious health condition form and the information you need to include. We talked about who can and can't sign the form, best practices when completing the form, and we talked about the designated representative request form. This is the end of our presentation. Thank you for joining us, and please contact us at paidleave.oregon.gov if you have any additional questions. Thank you and have a great day.